Today was the first event in a new project called Compassion in Healthcare, which is a partnership between University of Oxford researchers and the Royal Society of Medicine Open Section. And the event today was called Context for Compassion in Healthcare, Exploring Visions of Good. And what we were doing was we were bringing together researchers in the humanities to talk with, learn from nurses, doctors, others who work in healthcare around this theme of what compassion means, and I suppose what content compassion has in relation to the context compassion has. So patients, practitioners will come with attitudes, commitments, beliefs about compassion, about the world, and what we're interested in looking at is how those attitudes and commitments interrelate between patients and practitioners. It was wonderful to listen to someone like John Wyatt talking about the expert-expert relationship, or Anne Bradshaw, who's a nurse, talking about the history of nursing and how that should feed into our understanding of compassion. I talked a little bit about time and the way that the different experiences of time, the patient, the practitioner, should factor into what we mean by compassion. It's not just about the quantity of time, how much time we have. A little time can give time for compassion, but it's really about how that time is used. A practitioner who's got much more experience is able to make time for the patient because perhaps they're able to do the diagnosis more speedily and therefore go more deeply into the context, the background, which is going on behind the patient's experience. So that was very helpful for me today. I learned a lot. The whole project's about theologians, philosophers, others in humanities and law, listening to and learning with and alongside those who are working in healthcare. And I think we made a really good start today.